Direct care professionals play a critical role in supporting individuals with developmental disabilities, especially those who are nonverbal, because these individuals cannot tell us in words when they're not feeling well. It's vital for staff to learn how to listen with their eyes and intuition. Recognizing the signs of illness early can make all the difference in getting proper treatment and preventing complications. This takes patience, observation, and often a deep understanding of each individual's unique behaviors and routines. Changes in behavior are often the first clue that something is wrong. A person who normally enjoys certain activities might suddenly withdraw or seem irritable. Someone who is typically calm might become restless or aggressive. These shifts can be easy to overlook, especially if they're subtle, but they can signal pain, discomfort, or emotional distress due to an underlying medical issue. Staff should always take behavioral changes seriously, especially when there's no clear explanation for them. Physical signs can also offer important clues. Look for changes in skin color, such as paleness, flushed cheeks, or a bluish tint to lips or fingertips. Watch for sweating, shivering, rapid breathing, or changes in posture that may suggest discomfort. You may also notice a lack of appetite, vomiting, diarrhea, or unusual fatigue. These symptoms, though sometimes subtle, should be reported to a supervisor and documented, and calling 911 may be warranted if the symptoms or situations are serious enough. Knowing what is normal for each individual helps you recognize when something is abnormal. Sleep and activity patterns can also provide important information. If someone starts sleeping more than usual or has trouble sleeping at all, it could signal pain or illness. Likewise, sudden increases or decreases in movement, pacing, or repetitive behaviors might indicate that the person is trying to cope with internal discomfort or confusion. Because these changes may be mistaken for emotional or behavioral issues, it's vital to rule out health concerns first. One of the most reliable tools a caregiver can use is the familiarity they have with the person. Each individual communicates differently. Some may rock or hum when anxious, while others might tap, flap hands, or isolate themselves. When illness is present, these patterns often intensify or shift in unusual ways. Being able to spot those changes depends on the relationship you've built over time and your attention to the person's baseline behaviors and habits. Nonverbal individuals may also communicate pain or illness through non-traditional forms of expression. These could include increased vocalizations like moaning, crying, or yelling, changes in facial expressions such as grimacing or frowning, or protecting a certain part of the body, reactions to touch, pulling away, flinching, or showing signs of distress can also provide important clues. Don't ignore the body's language. It often speaks volumes when words cannot. Let's say a staff named Emily works with a man named Carlos who has autism and does not use words to communicate. Carlos usually smiles often, loves music, and enjoys sorting his picture cards. One day, Emily notices that Carlos is unusually quiet, doesn't respond to music, and refuses his favorite snack. Later, he grimaces when she helps him put on his coat. Emily reports the changes to her supervisor, who, in turn, makes an appointment with Carlos's medical practitioner, where it's discovered that he has an ear infection. Because Emily recognized that something was off, even without words, Carlos was able to get treated quickly. Documentation and communication are just as vital as observation. Care staff should write down anything unusual and report concerns to their supervisors promptly. The more details you provide, when the changes began, what exactly was different, and how long it lasted, the better chance healthcare professionals have to assess the situation accurately. Don't be afraid to speak up or trust your gut. You are the eyes and ears for someone who may not be able to explain what they feel, and your attention can be life-saving.